Cancer remains one of the most formidable health challenges of our time, affecting millions of individuals worldwide and imposing a significant burden on families, healthcare systems, and societies as research continues to unravel the complex mechanisms underlying cancer development and progression. Attention has increasingly turned to lifestyle factors that may influence both risk and recovery. Among these, exercise has emerged as a powerful, accessible, and multifaceted tool in the fight against cancer. The role of physical activity in cancer prevention and recovery is now supported by a growing body of scientific evidence, highlighting its importance not only in reducing the likelihood of developing certain cancers, but also in improving outcomes and quality of life for those undergoing treatment or living with a cancer diagnosis. The relationship between exercise and cancer prevention is rooted in the understanding that many cancers are influenced by modifiable risk factors. Sedentary behavior, obesity, and chronic inflammation have all been implicated in the pathogenesis of several cancer types, including breast, colon, endometrial, and lung cancers. Regular physical activity exerts a protective effect through multiple biological pathways. For example, exercise helps regulate body weight and composition, reducing adiposity, a known risk factor for hormone-sensitive cancers. By improving insulin sensitivity and lowering circulating insulin levels, exercise also mitigates the pro-carcinogenic effects of hyperinsulinemia. Furthermore, physical activity modulates sex hormone levels, particularly estrogen and testosterone, which play a critical role in the development of certain cancers. Beyond hormonal and metabolic influences, exercise enhances immune surveillance, increasing the activity of natural killer cells and cytotoxic T lymphocytes that target and destroy aberrant cells before they can proliferate into malignant tumors. Regular physical activity also reduces chronic inflammation, a recognized driver of carcinogenesis, by lowering levels of pro-inflammatory cytokines and promoting the release of anti-inflammatory mediators. Oxidative stress, another contributor to DNA damage and cancer risk, is attenuated by the upregulation of endogenous antioxidant defenses in response to regular exercise. Collectively, these mechanisms underscore the comprehensive impact of physical activity on the internal environment, creating conditions less conducive to cancer initiation and progression. Epidemiological studies consistently demonstrate an inverse relationship between physical activity and the risk of developing several common cancers. For instance, individuals who engage in regular, moderate to vigorous exercise exhibit a 20 to 30% lower risk of colon and breast cancer compared to their sedentary counterparts. The protective effect appears to be dose-dependent, with greater frequency, intensity, and duration of activity conferring additional benefits. Importantly, even modest increases in physical activity among previously inactive individuals can yield measurable reductions in cancer risk, emphasizing the value of incorporating movement into daily routines regardless of age or baseline fitness level. The preventive power of exercise extends beyond primary cancer prevention to encompass secondary prevention, reducing the risk of cancer recurrence in survivors. Studies have shown that breast and colorectal cancer survivors who maintain an active lifestyle experience significantly lower rates of recurrence and improved overall survival. These findings have prompted leading cancer organizations to issue guidelines recommending regular physical activity as an integral component of cancer survivorship care. Exercise prescriptions for survivors typically mirror public health recommendations for the general population, at least 150 minutes of moderate-intensity aerobic activity per week, supplemented by strength training exercises on 2 or more days per week. The journey from cancer diagnosis through treatment and into recovery is often marked by profound physical, emotional, and psychological challenges. Cancer therapies, while life-saving, can cause a host of side effects, including fatigue, muscle wasting, reduced cardiovascular fitness, neuropathy, and compromised immune function. Historically, patients were advised to rest and limit activity during treatment, but this paradigm has shifted dramatically in light of new evidence. Today, exercise is recognized as a safe and effective adjunct to conventional cancer therapies, capable of mitigating treatment-related side effects and enhancing overall well-being. One of the most pervasive and debilitating symptoms experienced by cancer patients is fatigue, which can persist long after the completion of therapy. Contrary to intuition, regular physical activity is one of the most effective interventions for managing cancer-related fatigue. Structured exercise programs improve energy levels, reduce feelings of exhaustion, and enhance functional capacity, enabling patients to better engage in daily activities and maintain independence. The mechanisms underlying these benefits are multifactorial, involving improvements in cardiorespiratory fitness, muscle strength, sleep quality, and psychological resilience. Muscle mass and strength often decline during cancer treatment due to a combination of inactivity, malnutrition, and the catabolic effects of certain therapies. Resistance training, when appropriately tailored to the individual's condition and abilities, can counteract muscle wasting, preserve lean body mass, and improve physical function. These gains are not merely cosmetic. Maintaining muscle strength is associated with better tolerance of treatment, reduced risk of falls and injury, and improved long-term survival. Aerobic exercise complements resistance training by enhancing cardiovascular health, reducing the risk of treatment-induced cardiotoxicity, and supporting metabolic regulation. The psychological toll of cancer cannot be overstated. Anxiety, depression, and cognitive impairment are common among patients and survivors, often exacerbated by the uncertainty and stress of living with a serious illness. Exercise offers a potent antidote to these challenges, with numerous studies demonstrating its ability to alleviate symptoms of depression and anxiety, improve mood, and enhance cognitive function. Physical activity stimulates the release of endorphins and other neurochemicals that promote a sense of well-being, while also providing opportunities for social interaction and support, key factors in psychological recovery. Importantly, the benefits of exercise are not limited to any single phase of the cancer continuum. Prehabilitation, or engaging in physical activity prior to the initiation of treatment, has gained traction as a strategy to optimize patients' physical and psychological readiness for surgery, chemotherapy, or radiation. Prehabilitation programs have been shown to improve postoperative outcomes, reduce complications, and shorten hospital stays. During active treatment, exercise can be adapted to accommodate fluctuations in energy levels and symptom burden, ensuring that patients remain as active as possible without exacerbating side effects. In the post-treatment phase, ongoing physical activity supports recovery, facilitates return to work and normal life, and reduces the risk of comorbid conditions such as cardiovascular disease, diabetes, and osteoporosis. The integration of exercise into cancer care requires a personalized approach, taking into account the type and stage of cancer, treatment modalities, comorbidities, and individual preferences and abilities. Collaboration between oncologists, physiotherapists, exercise physiologists, and other healthcare professionals is essential to develop safe and effective exercise prescriptions. Supervised exercise programs, particularly in the early stages of recovery or for those with complex medical needs, offer the advantage of close monitoring and tailored progression. However, Home-based and community-based programs are also effective and may be more accessible for many patients. Barriers to exercise participation among cancer patients and survivors are multifaceted, encompassing physical limitations, lack of motivation, fear of injury, and logistical challenges such as transportation and cost. Addressing these barriers requires a holistic and supportive approach, including education about the safety and benefits of exercise, motivational interviewing, goal setting, and the provision of resources such as exercise classes or online programs. Peer support and group activities can foster a sense of camaraderie and accountability, further enhancing adherence and enjoyment. Emerging research continues to refine our understanding of the optimal types, intensities, and durations of exercise for cancer prevention and recovery. While aerobic and resistance training form the cornerstone of most exercise prescriptions, other modalities such as yoga, Tai Chi, and Pilates offer additional benefits in terms of flexibility, balance, and mind-body integration. These practices may be particularly valuable for individuals experiencing pain, stiffness, or psychological distress, providing gentle yet effective means of promoting physical and emotional healing. The potential of exercise as a therapeutic intervention extends beyond symptom management and quality of life. Recent studies suggest that physical activity may directly influence tumor biology, slowing tumor growth, and enhancing the efficacy of anti-cancer treatments. Animal models have demonstrated that exercise can reduce tumor vascularization, alter the tumor microenvironment, and increase the delivery of chemotherapeutic agents to cancer cells. In humans, observational data indicate that physically active patients respond more favorably to certain treatments and experience fewer adverse effects. While more research is needed to fully elucidate these mechanisms, the prospect of harnessing exercise as a complementary therapy holds great promise for the future of oncology. In addition to its direct effects on cancer risk and recovery, exercise plays a critical role in the prevention and management of comorbidities that commonly afflict cancer patients and survivors. Cardiovascular disease, diabetes, osteoporosis, and obesity are prevalent in this population, often exacerbated by the long-term effects of cancer treatment. Regular physical activity reduces the incidence and severity of these conditions, contributing to improved overall health and longevity. The adoption of an active lifestyle thus confers benefits that extend far beyond cancer alone, supporting holistic wellness and resilience. The societal implications of promoting exercise for cancer prevention and recovery are profound. Public health campaigns, workplace wellness programs, and community initiatives all have a role to play in fostering environments that encourage and facilitate physical activity. Policy interventions, such as the creation of safe walking and cycling paths, subsidized fitness programs, and educational outreach, can help reduce disparities in access to exercise opportunities. Healthcare providers, too, must embrace their role as advocates for physical activity, routinely assessing patients' activity levels and offering guidance tailored to individual needs and circumstances. Despite the wealth of evidence supporting the benefits of exercise, gaps remain in our knowledge and implementation. Research is ongoing to determine the most effective strategies for integrating exercise into standard cancer care, identifying populations that may require additional support, and exploring the molecular and cellular mechanisms underlying exercise-induced benefits. The development of digital health technologies, including wearable devices and mobile applications, offers new avenues for monitoring activity, delivering personalized feedback, and enhancing engagement. As the field evolves, it will be essential to ensure that advances are equitably distributed, reaching underserved populations, and addressing social determinants of health. Education and advocacy are central to changing perceptions and behaviors around exercise and cancer. Many individuals continue to harbor misconceptions about the safety and appropriateness of physical activity during and after cancer treatment. Clear, evidence-based messaging from trusted sources can dispel myths, empower patients, and foster a culture of movement. Survivors who share their stories of recovery and resilience through exercise serve as powerful role models, inspiring others to embrace active lifestyles and reclaim agency over their health. The role of exercise in cancer prevention and recovery is a testament to the remarkable adaptability and resilience of the human body. Through regular physical activity, individuals can exert a measure of control over their cancer risk and recovery trajectory, complementing medical interventions with self-directed action. The synergy between exercise and conventional therapies highlights the importance of a holistic, patient-centered approach to cancer care, one that recognizes the interplay of physical, psychological, and social factors in shaping health outcomes. Looking to the future, the integration of exercise into cancer prevention and recovery will undoubtedly become even more central to clinical practice and public health policy. As research continues to illuminate the myriad ways in which physical activity influences cancer biology and patient outcomes, the imperative to promote and support exercise across the lifespan will only grow stronger. By embracing movement as medicine, we can empower individuals, transform healthcare systems, and ultimately reduce the global burden of cancer. In conclusion, exercise occupies a unique and indispensable place in the landscape of cancer prevention and recovery. Its benefits are wide-ranging, encompassing risk reduction, improved treatment tolerance, enhanced quality of life, and better long-term outcomes. The challenge now lies in translating scientific knowledge into action, ensuring that all individuals, regardless of background or circumstance, have the opportunity, support, and motivation to incorporate physical activity into their lives. By doing so, we not only confront cancer more effectively, but also lay the foundation for healthier, more vibrant communities for generations to come.